New South Wales has recorded 2,566 new COVID infections.
Breaking news out of Victoria now, 1,240 new infections.
Found that Omicron is becoming the dominant strain in Queensland and likely to become the main variant in a matter of days.
It's another very COVID-y Christmas, but this year, a lot of our pollies are singing a different tune.
The direction of Australia is overwhelmingly towards opening up.
What's key to us as well is personal responsibility.
We're not talking about lockdowns.
Yeah, none of us want a lockdown. But with 10,000 new cases in just 5 days, the AMA does want New South Wales in particular to mandate masks again. The government there is resisting, instead putting all the chips on boosters.
I think there's only one club that people should belong to here in New South Wales at the moment, and that's the Booster Club.
But with no change in the booster interval timeline, a lot of people can't join that club just yet. The federal government defended the program today, even as its own expert admitted there's reason to be worried about the Omicron variant.
The numbers, the transmission rate alone is concerning, and if we see high numbers, that sheer number of cases is a cause for concern. Think about wearing a mask.
It's taken just 3 new cases for Tassie to bring in its own indoor mask mandate, coming into effect at midnight on Monday.
So that will include offices, restaurants, pubs, clubs, also including public transport, or in taxis or ride sharing, retail settings, supermarkets.
But if things don't change elsewhere, exactly what kind of new year are we heading for?
Well, Dr. Dan Swan is an immunologist with the Garvan Institute and says we're sleepwalking into an Omicron disaster. Dan, you've contacted us because you feel there's an urgent need to get a message to the community. What is that message tonight?
The message is that the Omicron variant has some characteristics which mean that it is a profound public health threat. And because of our social mobility at the moment, it's spreading very quickly. And in the lead up to Christmas, we're going to have a huge super spreader event, which will almost certainly cause a hospital-based disaster in January, unless we take immediate action now.
Dan, I must say, throughout this pandemic, I've been very sort of single-minded in saying, listen to the experts, listen to the experts, listen to the experts. There are experts, though, like Peter Collignon, Nick Coatsworth, for example, who are hitting back at what they say is perhaps some alarmism about the Omicron variant. I mean, is there a risk that this is stoking unnecessary fear?
Yeah, 100%. So science it's a process, right? When scientists tell you something, they tell you the degree of confidence which they believe that to be the case, and they tell you why. Many people have said nothing about the Omicron variant because the truth is that we've been waiting for data. So we've been watching the outbreaks overseas in South Africa and in the UK, and we haven't said anything specifically not to raise alarm until we were really, really sure that there's going to be a problem. But we now know everything we need to know about this variant. We know how contagious it is. We know that it escapes the vaccines. We know how severe it's going to be, and we know how quickly it spreads, because we can already see that by the vertical nature of the case curve here in Sydney. So we know enough to know that if we let it spread, we're going to have a huge hospital-based disaster in January.
So what does that look like? What does a hospital-based disaster mean for us?
If you infect enough people with Omicron, a certain proportion of people need to go to hospital. That proportion is reduced by vaccines, that's the whole point, but not enough, that's the whole point. The Omicron variant means that the protection from severe disease falls, and it falls sufficiently so that if you infect enough people, you still have a huge number of people that will need to go to hospital, a number that well exceeds the hospital's ability to cope.
Doc, the Deputy CMO today said that you don't need to mandate to wear a mask, that we can take personal responsibility and wear them anyway. Do you think she has a point?
I think the key to Australia's superb pandemic response so far has been the grand alliance between leadership, science and community. Unfortunately, I feel like the government has left the field, and they've left it to the community and to science to talk to each other about what's best, which is exactly what we're doing tonight. If I'm right, what I'm telling you is that we need to mask up. We need to stop the spread of the Omicron variant. And so, yes, it is up to us. If the government isn't going to mandate it, that's their decision, that's their prerogative. They have reasons for their decisions. But I'm telling you that the right thing to do, and the absolutely essential thing for our community's welfare, is for us all to put our masks back on.
Dan, obviously everyone is looking to Christmas, looking to New Year, hoping like hell that this is going to get better. When you see the shape of the curve, when you see the daily numbers, when you see the response from the politicians around public health messages right now, what are you thinking, feeling? How are you observing this?
If we do nothing, if the case curve continues like this for the next 6 days, then what we're saying is that we're just going to keep spreading Omicron between us until Christmas morning, right? Now, then what's going to happen is that each of those people, which could be tens of thousands of people by Christmas morning, is going to go to a Christmas event with a 3-generation family, grandparents, ill people with cancer, immunocompromised people, unvaccinated children, and we're going to have a Sydney-wide or New South Wales-wide super spreader event because this virus is so contagious. It's fully airborne, and almost every single person in Sydney can be infected with Omicron because it's so different from the original virus to which we were vaccinated. So we have the potential on Christmas Day to have an enormous super spreader event all on the same day, and that will appear in our hospitals in the first week of January, all at the same time, which is exactly how you end up with excessive mortality in COVID, is when all the people that need care turn up in your hospitals at the same time.
Dr. Dan Swan, thank you very much.
Thanks very much, James.
I think it's fair to say that over the last few years we've been kind of overloaded with information about COVID and how to respond at the various different stages of this. I know there'll be those of you watching tonight that are really scared hearing that. There'll be others of you that say, look, you know, heard enough of these doctors and experts telling us to be worried and don't want to hear any more of it. I think, you know, obviously what we'll continue doing throughout this, and particularly through summer as the restrictions are easing and travel is sort of happening again, we'll continue providing the information. We'll listen to the different experts saying the different things that they've got to say. And it is, I think, fair to acknowledge that across the spectrum of public health officials, politicians, those making the decisions and those influencing and analysing the decisions, there is a spectrum of views about this, but there is certainly a number of medical professionals that are saying masks, some of those basic public health measures should be in place, or at least shouldn't be being eased as this Omicron variant spreads through the community. So it is scary times for everyone, particularly going into Christmas, but we'll keep making sure we provide all the relevant information.